Welcome back to Ask Dr. Rick on 590 The Fan, KFNS. If you have a question for Dr. Rick, please head to facebook.com/Ask Dr. Rick Lehman. Also, you can follow him on Twitter. Ask Dr. Rick now. Back to the show, presented by Bellman Buick GMC.
Ask Dr. Rick on 590 The Fan, KFNS, and it's brought to you by Bellman Buick GMC, located off I-270 and McDonald Boulevard. If you have a chance, make sure and say hello down at the auto show. Again, when you think about Bellman Buick GMC, they have employee pricing. That means you pay what the employees are paying for a car. If you're looking for a brand new 2012, they have $12,000 off. And one of the most unique aspects about Bellman is that you have guaranteed credit approval on the spot at Bellman Buick GMC, located off I-270 and McDonald Boulevard. All right, Dr. Rick, let's go rapid fire with some of the questions that folks have come in on with Facebook questions, facebook.com/Ask Dr. Rick Lehman. Also follow him on Twitter. He had some very good thoughts on the beginning of the NHL season. We'll hear more from Rick talking about the NFL season this week, and you can see his blog as well on his website. But Ask Dr. Rick Lehman, best way to reach us on Facebook. I'm Dan McLaughlin of Fox Sports Midwest, and we have Tyler Jones out of South County. Rick, he wants to know, how do I know when I should see a doctor? Because I'm not sure if I'm playing with pain or with an injury. Pretty good question.
You know, I think that's always the basis for every coach. Every coach says, hey, is this athlete injured or is he just having some pain? And I usually use the rule of 2 weeks. So if you twisted your ankle, or your elbow hurts, you got some swelling, I would tell you, ice it, get some anti-inflammatory, over-the-counter Advil, etc., and I'd give it 2 weeks. And if your situation doesn't resolve in 2 weeks, you need to go see your primary care doctor and say, hey, this thing's bothering me. Most things that are soft tissue, that are strains, that are pains, but really you don't have a true injury, are going to come and go in 2 weeks. And if it's a back pain or back injury, or you know that you've got, hey, my ankle's killing me, I roll my ankle. If it's not better in 2 weeks, I think it's time to see your doctor.
This is Angie McMullen. She writes in, she says she's 45 and wants to know a basic regimen of a workout that's tailored to women in their 40s.
Well, this is a very, very good topic, and this is really a timely question, and this is a very, very important question. And I think what's happened over the years is women have routinely worked out like men. So there's all this information out there. You go to the gym, you do 3 sets of 10, and you get sort of the boring, stale stuff. And so women have kind of adhered to that. And you get answers like, wow, I don't want to look like a guy. I don't really understand why, I'm getting these big thighs, etc. So women want to condition, and they want to do slimming exercises. And the best thing, in my opinion, is to get sort of a two-pronged approach. Number one, they need to do something cardio. I'm a big fan of elliptical. I'm a big fan of swimming. And I'm a big fan of exercise bicycle. So you pick one, and you're going to do some cardio 2 or 3 days a week. When you train, you have to get out of your comfort zone. So to go out there and ride the same 20 minutes at the same pace over and over again is not really effective cardio training. You got to do intervals. So you're going to do a minute as hard as you can go, and then you're going to rest for a minute, or you're going to, on an elliptical, ramp that resistance up, and you want to change up your workout, and you want to try to bump up the intensity of your workout. So that's the first thing. And then the other component of your workout has to be some type of resistance training. And in women, you have to think about what you're trying to do. You're trying to slim them out. You don't want to build big bulk. You want to tone the muscle, and you want to strengthen the muscle. And to do that, you have to do high reps at a high rate. So if you want to build muscle and you're 18 years old and you want to get cut up, you want to do low reps of 2, reps of 3, tremendous amount of weight, and you want to do them very, very slowly. In women, you want to do high reps, maybe reps of 25 or 30, and you want to do them fast-paced. And you want to pick out 4 or 5 exercises, depending on what you're trying to work on, your quads, your glutes, etc., and you want to hit those, and you want to hit those twice a week. You don't want to hit them every day. You need your recovery phase, but you want to hit them very, very, very rapidly. You want to do 2 sets, not 3 sets, and you want to hit those weights where fatigue at the end of your workout.
This is good stuff. And again, Ask Dr. Rick here on 590 The Fan, KFNS, and you can go to Facebook.com, Ask Dr. Rick Lehman, which is what Dan Kurtz has done. He writes in from Kirkwood. He said, Doc, I enjoy the show. My son is 7. I realize I'm not asking to start lifting weights at 7. However, what age should my son, who is an athlete, start doing various exercises with weights for sports-specific generalization stuff, too, as well?
I think that's an interesting question. We get that question a lot, and I think people want to know, hey, when can my son or daughter start to do some strength training, and when can they start to work out and try to build coordination? So from 7 to 12 or 7 to 13, he can work out. He should work out doing more agility stuff, jumping rope, trying to climb, and do basic functional activities. Monkey bars are great things. Pull-up bars are great things. And so these kids can work on agility-type activities. A thing I like to do for kids that are about 7, 8 years old is put a number of squares or dots or whatever on the floor and see how fast they can go, let's say, in a square pattern or triangular pattern from square to square. And all they're doing is jumping from square to square. And what you do is lengthen the distance over a period of time, and you time them. That's a great activity for a 7 or 8 year old. Once their growth plates close, which is about 13, then they should start some resistance training so they can do either bands or free weights or machines, whatever. But every kid 13 or 14 that's going to play sports needs to have a program where they're doing some strengthening. I'm a big fan of free weights. I'm a big fan of TheraBand, surgical tubing, and those programs should be done on a routine basis with acceleration of those workout programs. So every time they get to a place where, hey, I can do this exercise pretty comfortably, you need to bump it up. The key to working out is to be out of your comfort zone. You want to not be comfortable in your workout. And the way to do that is either bump up your reps a little bit or bump up the weight or bump up the speed with which you do the exercise. And if you do those things and you're a little bit uncomfortable every time you do them, you're going to continue to make gains.
He is one of the preeminent orthopedic surgeons, not just locally, but certainly in the country. Tony Twist, JJK, Craig Virgin, Nelly, all have gone through Dr. Rick Lehman, and you have a chance every Saturday to ask him questions on Facebook. So follow him on Twitter or Facebook.com/Ask Dr. Rick Lehman. When we come back, we'll talk a little baseball and what's happening with the Cardinals. In particular, Adam Wainwright. He is now going to be 2 years removed from Tommy John surgery. What does that mean? What kind of year can we expect? We'll find out with Dr. Rick Lehman. It's Ask Dr. Rick. And this is presented by Bellman Buick GMC, located off I-270 and McDonald Boulevard. We'll be back in a moment on 590 The Fan.